The death of Robin Williams has shaken many. Williams' suicide yesterday in his home in Northern California followed a decades-long battle with bipolar depression, bipolar disorder, and substance abuse. Mental health professionals say tragedies like this can be avoided if the stigma attached to mental illness is reversed.
And that's sometimes the difficult thing, because people still often equate depression or any mental health issue or addiction issue with a personal weakness, which it's not.
That was Dr. Kimble Richardson, a mental health counselor with Community Health Network. He says some of the warning signs of depression are problems with sleeping and concentration, changes in appetite, and shifts in mood.
Fans and colleagues continue on with a heavy heart after the death of actor Robin Williams. Today we learned the 63-year-old hanged himself at his home. Officials say he was also found with cuts on his wrists. Williams had been seeking treatment for depression, but there's no word on whether he left behind a note. Robin Williams' medical condition was obviously severe, but there are millions of people struggling with all levels of depression.
Yeah, and today we talked with a mental health expert about the many faces of the issue. Williams certainly in good company, joined by fellow comedian Roseanne Barr and comedian and actor Jim Carrey. Also comedian and host of The Price is Right, Drew Carey. Now, they have all publicly admitted to battling depression, but you know, that can be hard. There's still a societal stigma when it comes to people admitting they have a mental health problem.
Difficult thing, because people still often equate depression or any mental health issue or addiction issue with a personal weakness, which it's not. It's a medical condition that deserves and warrants treatment and help. People are afraid sometimes to talk about it because they're concerned that other people are going to think they're crazy or that they're weak, or they just don't want to be judged. And that's understandable.
And because so many people don't want to admit depression, experts say it's important to look out for your friends and family. Notice if there are changes in appetite or mood, or if they have trouble concentrating or sleeping. Those are all signs of depression. But there are ways to get help. For more information, look for this story on wishtv.com.